Hello, welcome to today's edition, today's show, today's class, actually. I think that's a better term. Thank you for joining me, everyone who is coming in live. And if you're watching this on the replay, thank you. You're welcome. I'm Dr. Sylvia. I'm a general practitioner and health educator with AskAwayHealth. And I'm so glad that you've chosen to click on this video or decided to join me here because we're going to be talking about a really important topic when it comes to women's health. And that is some symptoms that can develop in early stages of pregnancy. And of course, you might know there's so many different things that can happen in pregnancy, in the different stages of pregnancy. And we just want to focus and help raise awareness and create education for people who may not be so familiar with these ones and break it down a little bit to explain what to expect, what to do if these conditions happen. So we're going to be doing all that today. Please don't forget to like this video and subscribe to the channel. Like I said, we talk about everything to do with women's health, but also as it relates to your family, as it relates to your brother, your husband or partner, as it relates to your children, everything to do with women's health, family health, and your sexual and reproductive health care. We are here for that. We have lots of videos on the channel. We have the AskAwayHealth community forum that you can also use to share your thoughts, experiences, ask questions, and get other members of our community to provide support and provide clarity on something that you're looking for in a very safe space. So without much further rambling, let's just go straight into the issues that we're going to be talking about today. So I cover questions from viewers like you on this live streams on Fridays. I enjoy doing that because it gives me the opportunity to connect one-on-one, and sometimes YouTube comment space is not the place to answer questions, medical questions, and give you an idea or some direction. And then these live streams provide the opportunity for us to break down a topic. And so, of course, this is centered on a question I got from one of our viewers, and I'm just going to take us through just to give us a little bit of a clarity or some idea about this condition. So you've just found out you're pregnant. It might be your first pregnancy, second or third, or whichever. Congratulations, fantastic. Or you're thinking of pregnancy sometime soon. And it's good to be educated. It's good to be aware of what things could happen. And hopefully your pregnancy will progress nicely and smoothly. In some women, it doesn't. And there's some things that could be done to prevent that. And sometimes there aren't. The key thing is being aware very early on so that you can get quick medical attention and get things hopefully sorted out. So we're going to look at a couple of different conditions today. And I've talked about them being sort of extreme because they can happen in pregnancy and they're normal and things carry on. Mom and baby do well at the end of the pregnancy, but when they go extreme, that's when the problem is. So let's start with the first one. The first one we're talking about today is hyperemesis gravidarum. Hyperemesis gravidarum. And this is simply the condition that you're probably familiar with and you've heard of, I'm sure, before. If you haven't, that's fine. We're going to talk about it. Excessive vomiting in pregnancy. So we're going to be starting our discussion with that. This is not just morning sickness or bad morning sickness. Let's be very clear, okay? Morning sickness, as you will have heard or might have heard before, this is one of the most common symptoms in early pregnancy. We hear, oh, she feels sick or she's been throwing up, and we associate that with possibility of pregnancy. Now, don't forget, many other things can happen at the same time a lady is pregnant that cause her to vomit unrelated to her hormones and morning sickness. So let's put that on the table as well. And when you come to speak to us as your clinicians, we will be thinking about those other things before we say, well, this is probably or most likely morning sickness. Very simple example. Picked up a stomach bug. You've eaten something that doesn't agree with you and you've been vomiting and having diarrhea. That's not morning sickness. That's because you've got an infection within your stomach and bowels that would settle. That's not morning sickness. So not every woman who is pregnant suffers with morning sickness. Let's not forget that some ladies breeze through pregnancy without having any symptoms of nausea and vomiting. But if it is going to happen, it will start around the 4th to 7th week of your pregnancy for most women where it happens. And then it starts to tail off. It starts to settle down by week 16 or 20. In fact, for many women, it's settled before that. But in the majority of some cases might still continue up to 20 weeks. When I was a young, when I was a junior doctor practicing, we came across this very lovely couple, and I tell you, she had morning sickness morning sickness. She experienced excessive vomiting in pregnancy until she had her baby. We were able to control it to some extent, but she really struggled until she had that lovely, lovely child of hers. Everything else went on fine. But it just goes to show you how sometimes these things can be a little bit unpredictable. So that's morning sickness. Hyperemesis is severe vomiting. Severe episodes of vomiting that could potentially lead to harm for both mom and baby. We take it very seriously. Okay. So if a lady, or if you have hyperemesis gravidarum, what could it look like? You might experience very prolonged, persistent, and really severe episodes of vomiting several times during the day. It gets to the point where you can't even drink water because it's not even going to stay down. You're just throwing up and bringing up large amounts of water, or if it's small amounts, but you're doing it very, very frequently. So that's quite prolonged, it's persistent, it might carry on for a couple of days, at which point you should be thinking this is not normal. That's not normal morning sickness, where women might throw up or feel very nauseous. They might vomit once or twice, and then their stomach is settled. They're a bit queasy, but then they're able to get up. Later on, they might have a bite to eat and able to keep food down. In hyperemesis, you don't get that luxury. Women don't get that luxury. They struggle. And the other thing that would happen with hyperemesis, because it's progressing and the lady's losing a lot of fluid very quickly, is that she might lose weight, and sometimes up to 5% of a woman's weight before she fell pregnant. That's a big chunk. I know 5 seems like a small number, but when you check, it's actually a big amount to lose in a short space of time. So that's something else that could happen with hyperemesis. And of course, the one that makes us really concerned is the potential of dehydration and electrolyte imbalance. This is where you have lost so much fluid that your body cannot cope. So not only haven't you got enough fluid circulating, because your kidney is impacted, the levels of salt that should keep your body in normal functioning is just disorganized, and that could potentially lead to kidney damage or kidney injury and death for the mom, and of course the baby that she's carrying. So this is why we sit up when we hear that somebody when we think somebody has hyperemesis gravidarum. We do everything we can to reverse that condition, make sure that there are no complications. It is a serious condition. Now, how can we predict a woman who might have this, or who might suffer with bad nausea and vomiting, or severe nausea and vomiting? It's not very easy. We can't really tell who will have it. But some studies suggest that women who have multiple pregnancies, like twins or carrying triplets, a lady who is in her first pregnancy, so the very first time that she's pregnant, and a woman who had hyperemesis in a previous pregnancy. So if she's had this before, or if you've had this before in previous pregnancy, it may be more likely to happen. Or if you have members of your family, your mom or your sisters had hyperemesis, you may develop hyperemesis as a condition. And if you are overweight, these are some conditions where there might be an increased risk of developing hyperemesis. And I want to say at this point, if you're just joining the stream, hello, welcome. Where are you watching from? And we're talking about extreme or abnormal symptoms that could happen in early pregnancy. And we're just chatting about excessive vomiting. And if you've got any question or want to contribute to the topic, please feel free to send us a message in the chat section. But it's great to have you here. So that's hyperemesis. That's what it looks like. And these are the groups of people who may be more likely to get it. And don't get me wrong, I'm not saying that a lady who's not overweight cannot get hyperemesis. Just saying that in some studies where we've looked at comparing these numbers, the frequency of it happening in different groups of women, it seems to be a bit more common in women who are overweight. So it can happen in both groups, but you may find that it's more common in an overweight lady. So if hyperemesis gravidarum is happening, or if you're let's leave the name. If you're experiencing very prolonged, persistent bouts of vomiting, or any degree of vomiting. So I know you're wondering, well, why aren't I telling you a number? Why am I not saying, well, if you vomit more than 5 times in a day or more than 10 times? Well, because for everyone's different. Somebody who vomits 3 times in a day or within 6 hours or whatever might lose considerably more amount of fluid compared to somebody who vomits small quantities in that same period. I would like to see both of them. I would like to hear from both of them as a doctor so that we can decide. Each woman needs to have her assessment. So that's why we're not going to say to you, ooh, once you get to that magic number 10, off you go. No. Everyone, once you're experiencing vomiting that's more than once or twice, think about persistent, prolonged, severe. Those are the things that should make you think, right, I need to speak to my doctor or my midwife and so on. So if you're experiencing that degree of vomiting, weakness, feeling so weak, you can't stand, you can't just get up to do anything, it's difficult for you to move around as usual, you're feeling very dizzy or lightheaded because you've not been able to eat and drink, you've not been able to keep food or water down at all, for 12, 24 hours, it's important to contact medical services. Your doctor will be assessing how severe the condition is. That's why I said it's not we don't just use one woman's experience to make a general assessment or decision. Each lady should be assessed in her own right. We should know what each lady we should be able to talk about each lady's experience and assess based on her own symptoms. So as your GP, I want to know how severe your condition is. I want to know how dehydrated you are. I want to know whether your electrolyte balance has been compromised and if you need hospital admission. Those are the key things I want to know. So the tests I'm going to be doing, I'm going to be checking your vital signs, including your temperature, your pulse, that's your heart rate, checking your blood pressure, because these things can give me a clue that your body is struggling with whatever's going on. Those are the first initial clues, apart from the symptoms that you're telling me. Then a urine sample will be very useful. Of course, you know that from urine, we can check to see if there's glucose or sugar in the urine that's excessive, that shouldn't be present in the first instance. We can also check to see if there's blood. It can also tell us if you have ketones. So, and that's something that we primarily look for when we're assessing somebody with excessive pregnancy vomiting, ketones. That's really important because it tells us about dehydration and the suggestion of, this electrolyte imbalance I've talked about. Now, if we feel that you're at very severe stages and we can't look after you at home, then you would need to be admitted to hospital for monitoring, for treatment, which can include different things, stopping the vomiting, trying to replace any salts that are out of balance that you might have lost because of the vomiting, to make sure that mom fully recovers and that mom and baby are doing well. In some cases, you have excessive vomiting, but they're not as severe as a person who needs hospital admission. So we might look at other options, and there are other options. We can treat you with anti-sickness medicines to control the vomiting and hopefully help you get better well enough to start eating and drinking okay on just sickness tablets or medicines that you can have at home without needing to be admitted to hospital. But all that will also depend on how well you are, what your vital signs are telling us, and your urine sample is telling us. It's also important to look at what can you eat when you're pregnant, and that's something that women also think about. What, particularly if they're experiencing nausea, what's okay that will help my tummy, keep my tummy calm. There are different things that you could look at doing. It's useful to remember that you might need to avoid certain foods, especially if you're someone who's got a sensitive nose and tummy. There are some things that you might just need to avoid, and there are some things that if you eat might help to settle your tummy. So things like ginger, peppermint tea or peppermint aroma can be helpful, especially for those who've got really sensitive noses and strong smells. Just send them off. Lemon slices, the citrusy scent and flavor of lemon slices, that can be helpful. If you've got access to acupuncture, that is something else that you might find useful. Exercise, if you're able to, gentle exercise, maybe a light walk or yoga might help, or swim if you're access to that. If you're able to, that can also help to settle down your tummy and help to reduce the risk of nausea and vomiting. So what should you avoid? So this is really important, and it depends on the kind of person that you are, but generally spicy and fatty foods, can make nausea and vomiting in pregnancy worse. If you're eating lots and lots of spicy food, that might just upset the balance in your tummy. The other thing is eating very large meals. And so we say to pregnant women, it's about eating small food, spacing out your meals, having small amounts at a time. So that kind of grazing thing where you're not loading your tummy at any point, because that will trigger that reflex or trigger the nausea. Another thing to do is to avoid lying down straight away after eating. Try and sit upright for a good 60 minutes, really, to allow digestion to happen and to prevent your protective valve that closes off your stomach from your food pipe from opening up and then triggering that impulse to vomit or triggering nausea. And a trick that's related to that, and avoiding a full tummy, is when you're eating, don't drink your water, juice, or whatever at the same time. It might be that you need to finish eating the food, allow that to settle, and then take some water. Yes, I know it's counterproductive to what we've been saying. But this is in the instance that there is somebody who is at risk or prone to nausea and vomiting. This might be helpful to control that and help you feel more comfortable around eating. And then strong smells. I mentioned that a little bit earlier, but strong smells for some of us who are really sensitive, we've got really sensitive noses, and just smelling something might just trigger you. So it may be that you're actively doing something, getting them to stop, whoever you live with, if they love frying bacon first thing in the morning. Or very strong coffee, and just the odor just wafts up to you. It's like, oh my goodness. So it's just sort of planning and thinking around what is it that sets you off, and then controlling that. And lastly, for women who use iron supplements. Now, not every woman needs to take an iron supplement when she's pregnant, and particularly you'll only be given one if you're anemic. And if you're in that category of a woman who has anemia and you need your iron supplements and you're suffering with nausea, it could be a bit tricky. Of course, we could look at alternative ways of treating, but just a note that iron supplements or iron tablets can contribute to nausea. So if you're in that category, watch out for that. Now, this is how we treat hyperemesis. So it's something that could be managed at home, depending on how safe it is. In most severe cases, we have to admit you to hospital. If it is ignored, and it's really important, I've mentioned this before, that it could affect mom and baby, but if it's ignored, loss of the salts that contribute to the electrolyte imbalance can lead to kidney disease, kidney damage. It could lead to death. It could lead to, if that doesn't happen, a woman can be at risk of nutritional and vitamin deficiencies at a time when her body needs to be functioning optimally because she's supporting the baby. Okay, frequent episodes of vomiting, lots of acid that's coming up through the food pipe, increasing the risk of somebody developing acid reflux disease. Very, very uncomfortable. So it's important to try and get it treated before it gets to that level. It could increase the risk of developing blood clots. That's if we don't treat hyperemesis or excessive vomiting quickly. And of course, it can impact your mental state as a woman, as an expectant mom, when you want to concentrate on getting yourself stronger, healthier for your baby, getting things together for your baby, learning about the changes going on in your body, and preparing for a little one. Instead, you're laid down because of this illness. So it can have quite intense impact, and of course on the baby, because its source of nourishment is compromised. And so babies may experience preterm birth, low birth weight, are some of the conditions, or being small for their gestational age are some of the problems that could happen if a mom has hyperemesis and we're not treating it. So that's the first one. That's the first one I wanted us to cover. Again, if you're joining us, thank you. We're talking about early pregnancy symptoms or conditions of concern that you should be aware of in early pregnancy. We're going to go to the next common symptom, and that covers the rest of the conditions I'm going to be talking about today, which is bleeding. So the first example I'm going to be talking about is cervical ectropion. But before I do that, let's have a look. Bleeding in early pregnancy, extremely common. It can be caused by so many different things. I'm going to share my screen. Oh, actually, I think I should have a video. Give me a second while I pull this up. So bleeding in early pregnancy, very common. Lots of different reasons that it might happen. One of them is implantation bleeding, and implantation bleeding is where in very early pregnancy, while the fertilized egg is bedding down, creating space for itself, the placenta is developing and adhering, the pregnancy is adhering to the womb where it's going to receive support for the duration of the pregnancy. So implantation bleeding is one type of early pregnancy bleeding. Of course, this is not a severe type of bleeding. It's usually light spotting bleeding. Some women don't even experience any bleeding. It might be a little bit of a discharge. Some women don't even experience anything. What else can cause bleeding in pregnancy? Early pregnancy infections, sexually transmitted infections, urinary tract infections, and then a couple of other conditions. One of them is what we refer to as a cervical ectropion. Oh, I'm just going to remove. We've stopped talking about you, haven't we? So we're going to be discussing a cervical ectropion. Now, the term up here, cervical erosion, is a misnomer. It's no longer considered a useful way of describing it, but some women may recognize the term cervical erosion. But I wanted to talk about this today, not so much because it's an excessive problem in early pregnancy, but it can happen and it can cause a lot of worry when it happens. So a cervical ectropion is a change to the cervix. Now the cervix is part of the womb. The cervix is part of the womb. So let me show you. I'm just going to use this to demonstrate what the cervix is. So you can see this image that shows us three different photos of a pregnant womb. And the first one, you can see the womb, that's the uterus, the cervix, and the vagina. So you sort of get your anatomy in place. Now, what happens with the cervix? The cervix is the neck of the womb. And as you go into labor, see how it becomes thinner in the second image? It thins. That's what this effacement means. It thins, reddening the a canal, widening the canal that the baby's head and the baby is going to pass through. And you can see at the, this stage of labor, second stage, when the baby is now ready to come out, the the vaginal canal is now fully dilated. The os, is fully dilated. The cervical opening or the os is fully dilated to 10 centimeters. That bit of muscle that made up the neck of the womb, the cervix, has fully disappeared. So that's one of the really important functions of the cervix. I've got a couple of videos on the cervix. It's such an important part of our body, and I find that sometimes some women don't know what we mean when we're talking about the cervix or what it does. That is the cervix. But here in cervical ectropion or ectopy, that's another word for it, ectopy. What we're talking about is there's a change to the cervix. The soft cell that we usually find inside the canal, it spreads to the outside surface of your cervix. That's what it is. There's a change. So the outside and the inside are different types of cells. We call it the inside soft cells and the outside the hard or epithelial cells. This is known as ectropion or ectopy. Okay. Now, please go have a look at those videos. I'm going to put the links to them in the description box so that you can watch and learn about this. And I'm just going to briefly talk about it here. But it's not a disease condition to be alarmed about. This, when they say, oh, the cervix is affected by erosion, it doesn't mean that your cervix is eroding away or it's disappearing. No. Okay, so that's why I think this term is a misnomer and it's an old term. This condition, cervical ectropion or cervical ectopy, is common in women who are of childbearing age and in women who, for example, are using combined contraceptive methods like the pill. But some women are born with it. They're born with this nature, this appearance of their cervix, while some others develop it along the way. And it might be from hormone changes, like happens with women who are on the pill. And women can develop it in pregnancy, which is why it's relevant to our discussion today. It's not a disease per se. That change doesn't cause any loss of function. Doesn't affect fertility. Like I said, you can develop it in pregnancy, and it doesn't cause cancer. It's not cervical cancer, completely different. Okay. But if it's there, it can cause problems. It can cause headache. And that's because of the symptoms that it can cause. So first of all, Many ladies who have a cervical ectropion, they don't even know. They don't know because it doesn't cause any symptoms. And we may just find out when we're doing things like a pelvic examination for a smear or some other thing. And then we look and see, oh, it looks a little bit different. It looks, you can tell in many cases, just looking at it as a doctor or the nurse doing your examination, that this cervix looks a little bit more red, and we suspect, oh, she could have an ectropion. But the symptoms for ladies who get symptoms, they might have a discharge from the down below from the vagina. That's not very heavy, but it's just there. It's a bit irritating. It's where is it coming from is the question that ladies would ask. They might experience spotting in between their periods. It's not heavy bleeding, but it might just be nuisance spotting, and you're thinking, what's going on here? They may also experience bleeding during and after sex, and that bleeding may even happen with pain. Okay. And in some cases, this same bleeding or even pain can happen after we've done the examination. So you've gone along to have your smear. We need to insert a speculum. And then when we finish the smear, the procedure can be uncomfortable, but it shouldn't be painful. It's not so traumatic. And so most women do not bleed after they've had a smear. But when you finish and you come away and there's a bit of bleeding, on either the speculum or whatever, that may be a symptom of for somebody who has cervical ectropion, and it can cause bleeding in early pregnancy. At any point in your pregnancy, bleeding will alarm any woman. I believe you'll just be worried. So it's one of those things that could develop. It is not dangerous. It is more or less benign in terms of what it is. But if it happens, of course, it will raise your anxiety level until you know what is going on, what causes it. And by the way, it is actually amongst the most common causes of bleeding during the last months of pregnancy. Okay, so let's get rid of this. I think we've seen this picture long enough. Okay, so if you're just joining us, hi, welcome. Thanks for joining. We are talking about abnormal early pregnancy symptoms, conditions, some excessive, and we've just been looking at, or we are looking at, cervical ectropion is a topic that we're discussing now. Please, if you're watching this on replay, don't forget to like and subscribe to my channel. I would really appreciate your support for the work that we're doing here. So this is the cervical ectropion. What is it that we do to treat it or to even diagnose it? So I've already given you a clue that first of all, we may just see it when we're doing our routine tests like your smear. So it's possible that we can see that the cervix looks a bit more red, the surface looks a little bit rough. Say, okay, this might be an ectropion, and then we can maybe do a referral to the gynecologist so they can do a few more tests to confirm. In that case, the specialists will do a colposcopy, which is where a little camera with a bright light, they use that, and high magnifying lenses are used to look closely at the cervix tissues, and then they can better tell that this is an ectropion going on. Now, treatment depends on how troublesome the symptoms are. So actually, you might have an ectropion and it's not treated. If it's not giving you any symptoms, don't trouble yourself. Don't bother. It's not, like I said, it's not cancer. It doesn't lead to cancer. There's nothing to do. For some ladies, it might go away. For example, if it's somebody who's on the pill and she starts to have these episodes and we figure out that it is her ectropion, the solution may be to come off the pill to an alternative method. That might solve the problem. Or for somebody who's pregnant who's having those symptoms, the solution might be she has her baby. Hormone levels come back to normal, hey presto, and the symptoms settle. So it may go away on its own. But in some cases, it doesn't, and the symptoms are particularly bad. We've talked about bleeding after sex, bleeding after doing tests, bad discharge, and so on. It may be quite severe and need treatment. And in that case, what we do is to burn away that surface layer of cells. And that can be done using heat therapy or cold therapy or chemical therapy to clear that top layer of cells. And usually that's done as an outpatient procedure. It's not complicated. And then you go off home and your cervix is allowed to heal. And usually after 4 to 6 weeks, things should be normal and you're free of symptoms. And during that time, you're advised not to have sexual intercourse. You're advised not to use tampons, not to irritate the cervix. And many women who have the treatment without any complications find that their symptoms are resolved. So that's how we could potentially deal with a cervical ectropion and how it could be an issue in pregnancy, but not one to worry about, just to recognize that it is possible. So we're talking about abnormal symptoms in early pregnancy. We have talked about hyperemesis, which is excessive pregnancy vomiting, and we're now looking at bleeding and some of the issues it can cause. We've just mentioned a few, like infections. We've talked about something like implantation bleeding. We've talked about cervical ectropion. We've just concluded that we're now going to progress and talk about two more conditions that could develop. And the first one, hello, is a miscarriage. So we're just going to look at this in brief. So we'll be talking about a miscarriage and how it happens, what we do and what to expect with a miscarriage. Okay, and just again, if you're just joining us on the stream, hi, I've just given a little summary of what we're doing. Please don't forget to tell me what your experience is with any of these conditions that we're looking at, or in early pregnancy. Perhaps what you wish you'd known. I think that's also important. Perhaps what you wish you'd known. But here we're talking about miscarriage. A miscarriage is when a lady loses her pregnancy or her baby before 24 weeks. A miscarriage is when a lady loses her baby or loses the pregnancy before 24 weeks. The most common cause is abnormality of the baby, of the developing baby, because remember, these are very early stages and development has been going on and is still going on at this stage. So the most common cause is abnormality within the baby, maybe some genetic problem or something that goes wrong during development and the pregnancy cannot continue. And so it's not something that in most cases a woman has any control over. And it's really important to say this. But a miscarriage can also happen as a result of infection, whether it's a urinary tract infection, a sexually transmitted infection. It can happen as a result of severe stress or trauma, some type of injury. And there could be other ill health conditions that are not quickly detected or that a woman might have that make her have a miscarriage, or it might be some drugs that can contribute. So you can go into detail with different possible causes, but in the majority of cases, like I said, there are abnormalities within the developing baby that we don't know about, we couldn't control, and the pregnancy is unable to continue. What does it look like when a woman is pregnant? So either she has a positive pregnancy test or she has symptoms that suggest she's pregnant. So she has not had a period, or her period has been missed for a few weeks or is late. And she's having tenderness in her breast, or even nausea. We just talked about morning sickness. So a woman who is pregnant, either because we've done a positive pregnancy test or she has symptoms which mean or tell us that she might be pregnant, we look at any type of vaginal bleeding. There's no discrepancy. There's no definition that some types of bleeding are more suggestive of miscarriage than other types. No, any type of bleeding, discharge from down below, one of the things that your doctor will consider is the possibility of a miscarriage. So it might be spotting, scanty bleeding initially. You might have brownish discharge coming away or bright red blood coming away. It might start and then progress continuously for the next few hours or days. In some other ladies, it might start, happen for a few hours, stop, then start again after a few hours of the following day, stop, then start again after a few hours. So there isn't an exact pattern, is the message I want to get across. So it could happen in any of these scenarios. What we do know is that there is unexplained and unexpected vaginal bleeding. We have to take it seriously. The other thing that could happen to this woman who is pregnant is pain. And usually that pain is crampy type pain in the lower abdomen, okay? And it may also extend to the back. So she might have backache after the bleeding starts. Okay, so when you have these, if you experience these, you're pregnant, i.e. you're pregnant, you've done a test, and it's established that you're pregnant, or you're not even sure you're pregnant, but you might have those symptoms, and you now develop bleeding that's unexpected, out of schedule, it might be spotting, it might be heavier, it might be fresh, and you start to have cramping, low abdominal pain, then it's important that we're seeing you. It's important you're talking to a health provider. If you've not been tested for pregnancy, we'll have the test and find out is it that or not, and then take things from there. So any episode of unscheduled vaginal bleeding, I'm going to sing it and shout it again. Please, when you're pregnant or you suspect you're pregnant, please discuss with your doctor so that we can assess and decide. The other reason for that this is so important, and I'm just going to mention it by word quickly, is because of an ectopic pregnancy where the symptoms can be so similar, and we have to establish. It's important that we see you to establish whether it is this one going on or that or the other, miscarriage or an ectopic pregnancy going on. So when you come to see the doctor, what do we do? Again, we will look at your vital signs. They're so important. So from checking things like your blood pressure and pulse, and all that is really to establish that you don't have internal bleeding, which is a more likely outcome if there's an ectopic pregnancy and perhaps it's growing in the tube and it may have burst the tube. It's important that we do that assessment. We'll check your, we'll do a urine test. Remember we said some ladies may be established, we know they're pregnant, some may not be. So one of the first things that will happen is a urine test to check that whether or not you're pregnant. We will also check that urine test is also useful because it could tell us whether or not there's an infection going on that may be responsible for this bleeding. Not in all cases, but you can see that we're thinking of possibilities so that we can narrow down what might be responsible, what might be going on. Blood tests can also be done, and that blood test is looking at your hormone level. This is the beta HCG that we use to establish that as soon as fertilization happens, its levels start to grow. And what we have found is that specific certain levels are associated with certain stages of pregnancy. So when we see that the level is going up and continuing to go up, that indicates that pregnancy is progressing. But if it gets to you do a test and the level is lower than you expect, you do it the next day and the level is static, it's not changed, then you think, is this pregnancy going on? So that's how we use the beta HCG. The definitive diagnostic tool, or what we use to establish whether a miscarriage is going on or not, is the transvaginal ultrasound scan. This is why if you call out to your doctors, we either arrange an appointment to see you or we arrange an assessment for you at the early pregnancy assessment unit so you can have a transvaginal ultrasound scan. And by transvaginal, I mean that the scan will be conducted with a probe, an ultrasound probe that is inserted through your vagina, just so that we can clearly see the body of the womb, because it is still very much it's still very much within your pelvis, very much low down. Okay, so trying to use an abdominal, what's the word now? I can't remember the word for the device. Trying to do a trans that's on the top of you, trying to use the device on the top, rubbing it across the top of your abdomen may not give us a very good look of the womb, and to see properly into the body of the womb where the baby should be lying. So a transvaginal ultrasound is preferred to check on the progress of the pregnancy, and what we're looking at is the size, most importantly, the absence or the presence of the baby's heartbeat, and that tells us what's going on. If the heartbeat is not present, then that tells us that we're dealing with a miscarriage. Now, what happens next? Okay, so what is the next thing? I'm just quickly checking the screen to make sure I've not missed any comments here. Thanks to everyone liking the video, much appreciated. Thank you so much. So what happens next? Okay, what's the treatment? We've said, okay, we think we have a miscarriage, there's a miscarriage going on. What happens next depends on the mother's well-being, and of course what she prefers, what the intention is. And the reason I say that is, we're doing all these tests, we're checking your blood pressure and pulse, we're checking your hormone levels. One option is what's known as watchful waiting, and it looks as if nothing is being done. Well, nothing is being done, but monitoring and allowing the body itself to allowing nature itself to do its thing is the best way to put it. So just events to happen naturally. And what do I mean? When the body realizes that this pregnancy is not continuing, then that message is sent to the different organs that need to act, and that allows the process of the cramping process, where the contraction process and the womb tries to gently move this pregnancy that's no longer valid out of itself. So that can be the natural outcome of watchful waiting. Another option is having drugs to do the same, which is to trigger the womb to start contracting. That might be an option depending on how well or how ill the woman is or by choice. And of course, another option is surgery. I'm going to talk about that in a little bit. So when we're doing watchful waiting, it's also known as expectant waiting. It's usually, we don't sort of wait months and months, no, usually over a course of 7 to 14 days. Okay. And what you might expect is steady bleeding as the womb is emptying. Okay. And as we get to the 7th day, get into the 2nd week, the bleeding should begin to get lighter. If the bleeding is not getting lighter, if the bleeding is getting heavier, if you're experiencing more pain or any other symptoms, you should seek medical attention. The whole process should be done within those couple of weeks, and you're usually advised after 3 weeks to do a pregnancy test. And if that test is positive, then you have to go into hospital so that we can again do a scan and work out what's going on. The next method I talked about is medical treatment, medical management, where you're giving medicine to promote or stimulate the womb to start contracting. So this tablet can either be a tablet that you take by mouth, oral, or it might be one that's applied by the vagina, and the hormone is supposed to stimulate contraction and help empty the womb. And of course, we would have done the scans, and the scans have told us that the fetal heart is not present. And this option might be suitable. I'm just looking at my notes. This option might be suitable if a woman chooses, she doesn't want to wait, she prefers something just to help. I just want to move from stage A to stage B. I don't want the long wait. Or if your doctors feel that watchful waiting is not the best option for you. So that's that method. And again, the advice is given to watch out for abnormal bleeding, very heavy bleeding with clots, feeling very ill, very severe pain, because what women can expect to have some crampy discomfort that can be managed with simple paracetamol. So where pain is present, that is prolonged pain, severe pain, that doesn't go with simple paracetamol, that's not normal when you're having any of these treatments, and you should seek attention of your doctor. So the third method is the surgical method, and this is the method where either under local or general anesthesia, the doctors go in to empty out the womb, and it is the quickest. The result is fast. As soon as the surgery is over, then the pregnancy has ended. So that for some people might be a preferred option, because like I said, people want to move from stage A to stage B and not go through the whole process of waiting and waiting. This is something that has so much emotional impact, but I think what is of value is being aware. If ever a woman has to go through this, being aware of these different options and the supportive treatments that are available after it happens. In each instance, everyone should be offered counseling. This is bereavement. This is the loss of a loved one. And so it's important to take some time to go through this and recover, instead of sweeping it away or ignoring it or not speaking about it. Guys, let me know if you want me to do a more detailed video on miscarriage, how we talk to people who've had a miscarriage, more about the ins and outs. I'd love to do a video if you're interested in it. So surgical methods, please don't forget, possible complications can include an infection, very heavy bleeding after surgery, severe pain. All of these, please bring to the attention of your doctors as an emergency. Right, we are nearly where we are now. We're getting close to the end. I don't like my streams going on for longer than an hour, because I know it's a lot of medical information that we're talking about. So thank you again if you're joining me on live, and if you're joining on the replay, thank you so much. Guys, don't forget to like and subscribe to the channel. So let's move to the next big one for today's discussion. And again, it is bleeding. This is the ectopic pregnancy. And I've mentioned it a little bit. Let's go. Have I got any picture? I haven't got too many pictures for you guys today. You guys know I love sharing lots of pictures. And it's, again, the ectopic pregnancy is something that we're familiar with. I think I do have a picture, actually. So I'm going to change this. Yes, we are now talking about ectopic pregnancy. And it's something that many women are familiar with. It's something that we know. An ectopic pregnancy is a pregnancy that develops outside the womb. So let me just share this with you. Just check that you're seeing what I want you to see. Yeah. So I have on the screen just the image of a woman's reproductive organs. So we're looking at the body of the womb. So starting from the bottom here, we're looking at the vagina and then going into the cervix upwards, then going into the body of the womb. I'm just making a circle around the body of the womb here. And then you've got the two fallopian tubes. So these pink thin threads, and these are the fimbriae of the fallopian tube. And this cream structure here is the ovary. And of course, you have that on the other side, don't you? And when ovulation happens and the ovary releases a mature egg, the egg travels. It's amazing how nature works, because there is some little bit of space between the ovary and the tube, but somehow, as ovulation happens, the fimbriae, this sort of funnel bit of the tube, is sort of gently swaying and creating some kind of motion that allows the egg to travel in the right direction. And of course, if you've had intercourse, then the sperm are swimming up from the vaginal canal, traveling up through the womb, even coming to meet with the egg as it journeys its way down into the body of the womb. Now, I'm talking about an ectopic pregnancy, because what we expect is wherever the egg finds itself being fertilized, it should come and rest within the body of the womb naturally. For a pregnancy that is going to grow normally and develop within the womb, the egg should find itself within the body of the womb. An ectopic is when this does not happen. Most often, you might find that the ectopic pregnancy develops in the tube, most often. But it can also develop in other places. For example, it could happen in the ovary. Okay, it could happen in the ovary. The egg might sort of go out straight into the abdomen, and so the pregnancy form finds itself within the abdomen, no support from the womb, because it's so critical that the pregnancy implants to the womb where nourishment is going to start developing. But if it just finds itself in the abdomen or within the cervix, within an old scar, maybe you had the woman had a previous cesarean section scar, or in a part of the different parts of the fallopian tube, or different parts of the womb that cannot support a pregnancy. So it needs to go within the body of the womb. It needs to plant properly. So an ectopic pregnancy can happen in any of those locations, but most often it is happening inside the tube. Now, who is at risk of an ectopic pregnancy developing? In about 30% of cases, we can't tell. We don't know. So potentially it could happen to any lady, because we don't know why it happens. But we do know that there are some conditions that could make it more likely to happen. For example, damage to the tube, the fallopian tube. And this may be because a lady had an ectopic pregnancy in the past and it was treated medically. So the tube wasn't removed, but they had medical treatment. But there may have been some residual damage to the tube that's not obvious. And so during the next pregnancy, as the egg is moving and the sperm are moving, perhaps that damage provides a focus or a nidus where the new fertilized egg plants, and that causes another ectopic to happen. Or if a lady has had a pelvic inflammatory disease, PID, I talk a lot about this. I think I have a video or two dedicated to this to explain how it develops from, it could be from a sexually transmitted infection that rises up and goes past the vagina into the womb and the tube and the ovaries to cause pelvic inflammatory disease. Very serious condition. It can cause severe illness. One of the horrible complications is infertility or problems with getting pregnant. So these things could affect the tube and make a woman more likely to have an ectopic pregnancy. And something else that can cause this, or something else that has been linked with an ectopic pregnancy, is if a woman is over the age of 35 years and pregnant. So being pregnant and over the age of 35, a woman might be more at risk of an ectopic pregnancy, as well as smoking. Smoking, we say no to smoking at all, and particularly not when you're pregnant. So these are some of the things that might increase the risk of pregnancy. Should I mention the coil? Because I know some people will say, oh, well, what about the coil? The research, the evidence we have is that, number one, the intrauterine coil is so effective at preventing pregnancy. It reduces the overall risk of an ectopic even developing. So if you have the coil, you're less likely to fall pregnant. So how on earth could you even have an ectopic? Okay, so that's the first thing. However, if in that less than 1% chance of being pregnant, if it happens, then yes, an ectopic pregnancy can be the outcome, because of course the coil is sitting within the womb. So if you think about it, just mechanically, the egg is more likely to site itself within or outside the body of the womb where it should be. So having a coil does not immediately mean that, oh, you're going to get an ectopic, because the chance of getting pregnant in the first place is so low. That's what we say. With an ectopic pregnancy, if we don't treat it, it's a medical emergency. Please, I should have said that at the beginning. It's a medical emergency. If we don't treat it and the pregnancy has planted in the tube, it can continue growing without us realizing. It can continue growing till it bursts the tube and causes serious internal bleeding that can lead to death of both baby and mom. Okay. If it's not treated, or if it's not managed properly, it can increase the risk of having more ectopic pregnancies in future. And of course, the mental health impact that goes along with this episode or with this kind of journey is quite serious. So the grief process, the stress, the depression that can come out of it. So this is a really one of those horrible conditions that they are. One of the good things that we have, luckily, is being able to assess quickly, being able to make a rapid diagnosis and treat the problem, as well as watch out in next pregnancies. So what symptoms are we talking about? And again, I'll pull you back to our earlier discussion on miscarriage, because again, we're talking about primarily bleeding, abnormal, unexpected, unscheduled bleeding and pain. But sometimes you may not even have the luxury of that, because some women may not even realize that they are pregnant until the development of a sudden, sharp, severe pain in the lower abdomen or pelvis. They may not be bleeding. So this is something that doctors and nurses, all medical staff, need to be aware of. And that's why generally any woman within a childbearing age who comes with this kind of symptom, really bad pain or bleeding, one of the key tests is to make sure, is she pregnant? Could it be an ectopic? Really important. So when symptoms happen, they generally appear around 6 or 8 weeks after the last period, the last normal period. In some cases, it might be a bit later if it's not in the tube, because the 6 to 8 weeks generally is the size that the pregnancy can remain within the tube. Because remember, the tube, you can see how tiny the tube is, how narrow it is, isn't it? So a pregnancy of 10 weeks is not going to survive in there. It would have burst the tube well before that happened. So it's just one of those things that we use to gauge. But it could be an older pregnancy if it's not sited in the tube. Remember, I said the tube is just one of the most common locations. It could site anywhere else. So the problems, as I've mentioned, are tummy pain and pelvic pain, a missed period, vaginal bleeding, can be heavy, could be light, could be spotting, could be any type of bleeding, brown discharge, whatever. It could start with any of those. It could have clots, and then it could progress. So we take serious any complaint of unexpected, unscheduled bleeding. Less common symptoms may be breast tenderness. So because there's a pregnancy, the pregnancy hormones start to go up, and then we start to get things like tenderness in the breast. Might be an upset tummy, irritation of the tummy. The lady may have diarrhea or vomiting. If she's lost a lot of blood because of internal bleeding, because the tube has been leaking, it's opening, it's torn because of the egg that's growing, and the tube is tearing and bleeding, just dripping out little bits of blood into the pelvis and the abdomen without us knowing. And that could affect the woman, causing dizziness. She might faint, because as she's losing that blood, her blood pressure is going down. And so that's why we do your vital signs. Again, I know I've repeated this, but it's really important because it gives us a clue as to what might be going on. Some women develop a shoulder tip pain. So that's pain at the tip of the shoulder on either side. And it could be because it follows on from irritation, because there is bleeding within her pelvic area, pelvic space. Some of the tissues and nerves are irritated, and that causes that pain. We may not see that. The fact that it's not there doesn't mean a woman doesn't have an ectopic, but it may happen in some ladies. There may also be problems passing urine. It might be painful to pass urine. There might be pain when the woman is going to toilet to do number two, to do a poo, or she might even pass pregnancy material from the vagina. It all depends on the stage and what's going on. So the test that we will do tests like I've mentioned. Your vital signs, your blood pressure and pulse are important. We will check the urine to check, is this related to pregnancy? The beta HCG level is important because it's that hormone that as soon as fertilization happens starts to go up its levels, and we can use that to determine whether a pregnancy is progressing normally or whether something is wrong because it's not moving, it's not going higher as it should be doing. And of course, the transvaginal ultrasound scan is the test that we use to establish, is there a pregnancy in the womb? And if it isn't, where is it? Okay, so that's the use of a scan to tell us. And there are different types of treatments for an ectopic pregnancy. It may be that some vaginal medication that's given. There might be some other treatments that are used to cause the death of that pregnancy and stop it surviving inside the tube without damaging the tube. And there is the possibility of surgery. And it all depends on the stage and, of course, the wishes of the woman involved. So it's important that it's identified properly. It's important that we are working hard to detect ectopic pregnancy. There we go. Yes, so it's important that we're working hard to identify it clearly, doing the best to treat it promptly, and then providing the support afterwards, because it is a very difficult time for a woman who experiences this condition. Guys, we've come to the end of today's class. Thank you for being patient to stick with me all the way to the end and for listening. I hope you found this helpful. I did want to share these topics for ladies out there who maybe it's the first pregnancy or they're thinking of pregnancy. And the important thing is to be aware of these conditions, not necessarily because you're likely to get them, but because if they do happen or if these symptoms do develop, you have you understand the degree of urgency that's required. That should cause you to seek quick medical attention, to look into things and get you the right treatment that you need. So thank you for joining me. Yesterday we published a video on the best birth control methods if you have heavy periods. I've got that a lot from my in my comment section about struggling with heavy periods and not being sure what method to use. This video answers your questions, so please go and check it out. Just published yesterday. The link will be in the description box below. And again, thank you so much for joining me, and I will see you again next week. Bye bye.